Hi, Care Prevention, and welcome to chronic injury of the knee. And we are going to look at probably the most occurring injury in sports today. The most injured joint by many resources is the knee. The most common occurring injury in sports is tendonitis of the knee. And so when I hear that term tendonitis, I immediately know tendon inflammation of, and that suggests chronic injury. And remember, chronic injury is something that happens and it keeps occurring. A good thought on this is to kind of imagine how injuries occur and we kind of try to keep going and playing through it. And so inflammation process keeps occurring, and then pain keeps occurring, and then spasm keeps occurring, and then we don't do anything about it because we kind of lose function. And it kind of hurts to do stuff, and so we just kind of let it continue. And once we get into that state, we find ourselves in kind of a cycle of chronic injury. So the first one on our list, and you'll notice I have a very different model. Again, it's of the left leg, and so we have consistency there, and that's a good thing, right? But what you'll see here is this is the kneecap. The quadriceps muscles come down and they form the quadriceps tendon going over that kneecap, just like we talked about in the previous video. And then we find the patellar tendon. And so what I want you to do is, while we're going through this video, is reach down and find your patellar tendon. And the best way to do that is to let your knee bend and just go past your kneecap, and you can feel it just on the anterior aspect of your knee right here. Well, one of the big things that we do for assessment of patellar tendonitis is we like to understand where the pain is. Now, if they come to you and your athlete specifically, or maybe your son or your daughter, they come to you and they say, "My knee hurts." Well, your first question, going back to your secondary survey, is, well, why does your knee hurt? Well, if you watched the first video on acute injury, you started kind of asking some of these questions. Well, what happened? And you know, we gave very well-defined mechanisms of injury, right? So that was valgus, varus, falling on a flexed knee. That was falling on a knee and my kneecap popped out. Those are all well-defined. This person who has patellar tendonitis is going to say, well, I don't know. I've been very active. I've been running. I've been jumping. I've been squatting. You fill in the blank, and now my knee hurts. And they can't really identify a very well-defined mechanism. Many times they don't have a pop like they would with those acute injuries. Many times they don't have really anything that's outstanding about what caused their injury. They just know that now their knee hurts. And so they've developed this pain, and typically it's right here in this patellar tendon. Now, when they do that, you can usually touch this patellar tendon and find pain. But if you're touching it and it's painful, they're pretty advanced. Usually what they'll say is, my knee kind of hurts when I start to do this, which is mostly running or jumping. But then it kind of gets better. But then when I quit and I've ended my workout, that's when it really starts to hurt. That's kind of a common tendonitis thing, is it gets a little better with activity, but then when they cease activity, that's when they really start to develop pain. And so what I would look for is that they can remark that there's pain there. Almost every time that's patellar tendonitis. And then the question comes up, well, what do you do for it? Well, what I tell everyone in every class that I've ever taught is that tendonitis is kind of like a bad relationship. And if you have a bad relationship with a boyfriend or a girlfriend, the only thing that you can do to improve your health is to end the relationship. Tendonitis is just a bad relationship with whatever sports you're performing. And so what you have to do is you have to either end the relationship or at least reduce the frequency of which you're participating in that relationship, right? That's the only way you can get their attention so that you can create a more healthy relationship. Well, to get this a healthy relationship, you're going to have to reduce. So a good example is a basketball player who is participating in basketball practice who has patellar tendonitis. We're going to have to reduce what they're doing. We're going to have to rest them. And coaches don't like to hear this, but that's probably the best treatment, is to at least rest them a little bit. Now, I'm not saying that they don't participate in anything. There are other things that we can do, and as physical therapists and athletic trainers, we treat these a lot, and that person doesn't even lose conditioning because we have modifications to their activity. We also have alternatives to help keep their conditioning, but we also focus on a very local treatment. And so the best treatment here is first rest, modification of activity, but then second, we have to focus on strengthening this tendon. Now, a lot of times they're like, great, we'll do squats, we'll do lunges, we'll do leg extensions, and that's not always quite what we're looking for in therapy. We're looking to do other things, and I don't really get into that in this video. I'm more about assessing this and telling you to shut them down, get them to the right professional to treat this. Another thing that we will do to take care of this is wear a chopat. Keep on going down, you're going to see a picture of a chopat. That's just simply a little strap that goes across this, and many people really have a lot of good results just after a little bit of modification, strengthening, and putting that chopat on. The next one on our list is IT band syndrome. And IT band syndrome is over here on the lateral side. You can see the IT band, and that's a big long piece of tendon, and it starts up here on the tensor fasciae lata muscle as well as the glute medius muscle, and it comes down the lateral side of the knee just on the outside of the kneecap, and it inserts down here on a small bony protuberance on the tibia, so it passes the knee joint. And this is more common in runners. In fact, we call this condition runner's knee. Patellar tendonitis is jumper's knee. But runner's knee occurs very haphazardly and very oddly because a runner will start to notice their outside of their knee hurting because their mileage has gone up, and all of a sudden they figure out, wow, my knee hurts. And so we try to look at this as a knee injury. It's actually not a knee injury at all. It's a hip weakness. And so the injury comes from this glute med or gluteus medius muscle being weak and letting the knee, as it goes into weight bearing, go into a dynamic genu valgum or knee valgus, which remember is the lateral lateral movement of the distal segment of a joint. And it's happening in a dynamic component, and that is stressing this distal end of the IT band. But we correct it by strengthening this glute muscle. And so that's a lot of doing hip abduction. And there's a whole series of exercises of hip abduction that you can do in weight bearing as well as in non-weight bearing to strengthen that up. But typically 2 to 3 weeks is required at a lower volume of running, at a high volume of hip abduction strengthening to get that problem to resolve. Otherwise, they're going to continue to have the problem. And this is very frustrating for a runner and a coach because they think it's more of a knee problem. And so you get in there and you're icing it and you're heating it and you're ultrasounding, you're doing all these things right here, but you're not doing anything to fix the problem because the problem is right here. And so remember, if you're going to take care of an IT band syndrome, you're going to have to affect the hip. Next one on our list is bursitis. And really what I'm talking about here is the pes anserine bursa. And I know I just said a really big word, and I'm sorry about that. But the pes anserine literally is where 3 muscles come in on the Gerdy's tubercle on the medial aspect of the knee. And this is kind of the exact opposite area of the IT band where it comes in on the tibia. These other 3 muscles, the semimembranosus, semitendinosus, and the gracilis all come in and they attach right here on, I said semimembranosus, sartorius, semitendinosus, and gracilis all come in and they attach right here on Gerdy's tubercle. Well, right by Gerdy's tubercle, there sets a bursa, and this is a pes anserine bursa, and this bursa is pretty small, but it gets irritated typically by running and not having the conditioning, so you take your running volume up way too fast, and then you have medial knee pain. This is typically very easily controlled by proper knee strengthening. Again, go to that PT, that PTA, or that athletic trainer and get the proper knee strengthening to take care of that. And then typically in 2 to 3 weeks with lower running volume, again, the bad relationship, you get these things taken care of. Last thing on our list is patellofemoral pain syndrome. This is a very difficult thing to assess because the patella has become unstable. And you look at all this muscle around the knee and you think there's absolutely no way a patella could become unstable and not just have a dislocation problem. But what happens is this kneecap is unstable and it's causing some friction as it glides through. And I don't know if you remember the bony model, but the femoral condyle down here at the end, where it slides through that in natural movement and flexion and extension, it will become irritated, and so their kneecap hurts. And so again, lower the volume, strengthen the knee, but it takes the right kind of knee. So look below and you'll see our knee exercises. It's kind of a good starting point. It's our favorite knee exercises, but it's a great place to start. If you have any questions, make sure you're shooting me emails. Again, this is chronic injury. Make sure you know the difference between the acute injuries and the chronic injuries. Take a look down below, look at our pictures, but also look at our video about our favorite ways to start knee rehab. See you soon.